Hello, everyone, and happy Monday. So, we are going to be talking about chronic pain and inflammation from a different perspective. We've talked about this topic, chronic pain from Ayurvedic acupuncture, but today in our studio, we have a chiropractor, Dr. Robert. He is a leading chiropractor who kind of goes between sports medicine and functional medicine and takes care of a lot of different issues related with chronic pain. So welcome, Dr. Robert.
Mita, thank you so much for having me. I'm so excited to be with the NourishDoc show today. And so thanks again.
You're welcome. You're welcome. So let's just understand, first of all, before we understand what the difference is between chiropractic care and general other care, what exactly causes chronic pain and inflammation?
Wow. So that's a great question. So chronic pain, for those listening, is actually more prevalent than diabetes, heart attacks and strokes, cancer combined. And so it's a national epidemic, and it's from a lot of different things, but a lot of it's inflammatory in nature. So we know that chronic inflammation is one of the key drivers of pretty much 99% of diseases, right? They all have some inflammatory component. And so how do we heal these from a natural perspective? And so that is where, chiropractors are very well versed in doing so on the musculoskeletal side. What a lot of people don't realize, though, is that chiropractors, a lot of people, when they think of chiropractors, they think of neck and back pain. And while chiropractors are very good at that, they're also trained in a whole host of natural approaches to the human physiology. So from diet guidance to exercise, protocols to proper supplementation. So it's really, chiropractors are really geared for pain in a natural way. So instead of, going on an NSAID or opioid for years and years on end and not really getting anywhere, and actually more research actually showing that NSAIDs can actually block cartilage metabolism. So you're blocking pain initially, but you're not actually letting the cartilage to heal. And so that's when you get further degeneration, osteoarthritis, chronic inflammatory arthritis, right? That just causes more bone on bone. Whereas a chiropractor might instruct the patient on, more motion, more movement, more movement-based therapies, more natural-based supplements like glucosamine or chondroitin, or maybe even collagen to help the natural production of, chronocyte production, which is the cartilage-containing cells. So really, all chiropractors practice a little bit different, but really we're really poised to being, frontline providers for chronic pain and inflammation.
Sure, sure. So, but what is the root cause of inflammation in our body? I mean, there could be so many different things, right? Like we just said, different ailments. But what are the other reasons that the inflammation will go in our body?
Well, it can be from injury, right? It can be from injury that didn't heal correctly. So now you're having chronic pain, chronic inflammation from that. It can be from lack of sleep, right? It can be for blood sugar imbalances, chronic stress. It can be from HPA axis dysfunction, which is, if you're on stress overdrive, you're not going to be able to heal. You're going to have too many catecholamines in your system. Your body's going to be in fight or flight where it should be more calmer. So chiropractic is very good, at the nervous system, actually balancing the HPA axis system from more sympathetic, which is kind of fight or flight, to more parasympathetic, which is more kind of rest and digest. And so there's a lot of different things. A lot of people just think of, chronic pain as an injury, right? But there's so many different things that are inflammatory, in nature, like fibromyalgia, maybe chronic regional pain syndromes. These conditions, there's a lot more happening than just the injury itself. And so it really takes a total mind-body approach to, help with these inflammatory conditions.
Sure. So I know you also focus on sports medicine, right? So let's just understand the inflammation that happens because of sports injury versus someone suffering from fibromyalgia. Is there any similarities or not?
It just depends, right? So that's when you have an injury, you want some inflammation, right? You want some, some inflammatory mediators to come into that area. You want macrophages, cytokines, and healing factors to come. The problem is we don't know how to turn off inflammation in some cases, and that's where we get into trouble. So basically, chronic pain is usually pain that's lasted or persisted for longer than 3 months. Now it's gone from the acute phase to the chronic phase. Once this pain has persisted and still going on, well, if you got excessive inflammation, your body's not healing, right? And so it's going to affect your mood if you have chronic pain for a long time. Now, fibromyalgia, it's a whole different thing, right? It's gut health intertwined with mitochondrial health and oxidative stress, and that's a different thing altogether. In my opinion, it can be the same in some instances, but a lot of the sports medicine aspects is getting people out of pain so they don't have future injury later on in life. And so we can prevent osteoarthritis, prevent, these joints or these ligaments from being too loose, which causes further degeneration as well. So sports medicine in the chiropractic world is, a lot of different ways to be proactive to keep the athlete or the weekend warrior as healthy as possible so they can keep doing their activity. Because one thing that happens when you get pain, and we all know if you have a lot of pain, you don't want to exercise. You don't want to move because you're scared that your body is going to be in more pain, or you're scared that you're actually going to injure your body further. So blending sports medicine in there is going to say, hey, like this pain is acceptable. We can get this pain down to a low level to allow you to still exercise and keep moving, which is going to help inflammation. Probably one of the best things we can do for inflammation is exercise.
Wow. And it's difficult to move when you're inflamed, right? I mean, it's either your body's inflamed from inside, right? So because of toxins, or outside because of sports injury. Right. And so, and what kind of testing would you do to figure out what the inflammation is from inside? We can't hear you. I don't know. We lost you here. Yeah, we lost your voice. No, we cannot hear you. You are on mute. You have to turn on your this thing. I don't know if I can do it. We cannot hear you at all.
Sorry about that. My microphone went in and out for a second.
That's okay. That's okay. So we were talking about the inflammation, right? There is an inflammation inside the body. That's one inflammation. And there is inflammation because of sports injury outside the body. So the outside the body is obviously visible, but the inside the body, what kind of tools and what kind of testing are we doing?
Yeah, so some of my favorite testing for seeing the inflammatory component is first checking your vitamin D levels, making sure that the vitamin D is in the optimal range. So many people are deficient way below 30 nanograms. In my opinion, the research is showing that if you want a proper immune inflammatory control, that your vitamin D should be anywhere from 40 to 60, maybe even that 50 to 70. So if we know that you're having a lot of musculoskeletal pain, or maybe fibromyalgia pain, getting that vitamin D and maintaining vitamin D throughout the year is critical. Probably another one that most people think of for an inflammatory marker is C-reactive protein, or CRP. When you're doing that test, you want to look for the high sensitivity CRP, because that's going to show you where inflammation is in your body, how much do you have. Unfortunately, it's not going to tell you specifically where that inflammation is coming from. So that's where you got to rely on the clinician to evaluate you, figure out, do you have systemic inflammation, or is this coming from a knee or an injured body part? So that's one of my other favorite ones. You can also look at erythrocyte sedimentation rate. You can look at ferritin levels. You can see if your iron stores, because iron stores is also inflammatory, but also blood sugar. So blood sugar is one that a lot of people don't think about. And so if you have insulin resistance, you know that you're having inflammatory issues inside of the cell. And if you're having all these insulin blood sugar issues, you're probably gonna have a hard time with inflammation and a hard time healing from injury, but also probably dealing with a lot of chronic pain as well.
So you're combining the nutrition element, right? And then now, as far as the chiropractic part of this whole puzzle, so I know chiropractic do adjustments. What exactly would you do from a chiropractic point of view? We understand from the nutrition point of view, but from a chiropractic point of view, how does it fit in the puzzle?
Great question. So there's so many different types of chiropractic care, and that's good, right? Because not everything's going to work for everybody. But traditionally, chiropractors are going to look at the body as a whole. They're going to look how you move. They're going to look how you sit. They're going to look at your posture at work. They're going to look at all these contributing factors to your ergonomics, to why you're having this pain. Because a lot of times you can have low back pain that's not actually coming from the low back. It could actually be coming from the hips or the ankles, right? It could always be above or below that injury. So chiropractors, are really primed to look at these issues. And that's what we did, or what we do in our practice is more sports related. So looking at the body as a whole, looking at the knee, but looking above and below that knee to see, hey, your knees hurt because it's taking on too much force because your ankle dorsiflexion or your ankle mobility isn't there, or your hips are tight because you sit too long. And so really just combining this whole body approach
Mm-hmm.
They're looking at the nutritional side, looking at the biochemical side, and
Mm-hmm.
why are you still inflamed? Well, a lot of people that I saw that weren't healing, I'll say, what do you eat? They say, well, I go up to this fast food joint for lunch, and then I go to this fast food joint for dinner. I barely sleep because I have a bunch of kid things going on. I'm super stressed. And that's just one reason why people don't heal as well as they should, right? Because typically injuries should heal in a timely fashion, right? As long as they're not too severe, nothing's broken or torn, they should be able to heal. But a lot of the patients that I saw that didn't heal, they had some other stuff going on with the inflammatory components, with these sleep issues, the lifestyle factors, right, that were contributing. So it's really, I think it's a whole body approach, and that's where chiropractors are really good at looking at it. And not to take away from anyone else, because usually chiropractors work with other physicians, with other MDs, to really provide, a team-based care approach to helping patients with this chronic pain epidemic.
Sure. So what would be your prescription look like, in the sense, like, would you give a diet plan along with some kind of an adjustment, along with some exercises? I mean, what does it look like? Like, if someone comes to you with chronic pain and inflammation, what would be your prescription from a toolkit point of view?
Sure. So as you said earlier, we bridge the gap between sports medicine, functional medicine. So a little bit different, right? Some people might just be all sports, some people might be all functional. So I think it's kind of where we come in. It's kind of cool, is because we can look at the body as a whole, look at the movement, dysfunction. You're not squatting correctly. You're not hip hinging correctly. Your range of motion in your hip or knee is off, and is causing imbalances here or there. And then we can look at the diet. Say you're eating very inflammatory foods, seed oils, etc. So we're going to change that up for sure. We might even do a food elimination diet to see if there's any food triggers in there. But then we also might recommend supplements. Not everyone's going to get the same protocol, because everyone's different, of course. And so it might be, magnesium, a turmeric, a fish oil, a good quality multivitamin to help in there. And so a lot of times it's a lot of education too, because we don't want to see people in our office forever. We want them to get better and to, maybe see us for 3 or 4 times for the injury, maybe a little bit longer for the functional medicine side. But we don't want these patients to be in our office forever. If they are in our office every day or every week, right, we're not doing our job. And so it's a big education piece, and just showing them exercise that they can do at home to help with the injury, to help with the inflammation when it comes back. Maybe they sat too long. What do you do at that point, right? We want to show them stretches so that they can actually be proactive in their health.
Sure. And how much time approximately does it take if someone comes with a chronic pain and inflammation to you? Is it like a process of a few months or a whole year? I mean, what are we looking at? Great
question. So everyone's different, as you know. We practice a little bit differently. We spend a lot of time with patients. First visit an hour, second visit 30 minutes to an hour. Just depends on what we're dealing with. If it's just an injury, like a sports medicine injury, and we're using soft tissue therapies, we're using integrative active care rehab, we can get patients better, 3 to 6 visits, right, pretty quickly. But what do you do after they're from the holistic functional medicine side? That takes time. If they're really bad inflamed, if they're overweight, we didn't even talk about weight, but that's a huge issue. I believe the study, if you have 5 pounds of excessive weight, you're putting an enormous amount of force on your joints, every single day. So that's critical. Getting a healthy weight, maintaining that throughout your adulthood is key. But so we want to keep patients. If it's a fibromyalgia, that's going to take longer, right? But if it's just a inflammatory patient who's got an injury, we're getting that injury solved, and we're looking at the nutrition side, looking at the supplements they're taking, looking at their sleep, looking at their stress, and just combining all of those together into one kind of comprehensive plan. Yeah, no, I think that makes sense. So is there anything that people can do at home to alleviate the chronic pain? I mean, what would be your message to viewers? What should they start with? Well, I think everybody is a magnesium deficient, right? But always ask your doctor first. But I believe we're not getting enough magnesium-rich foods in our diets. Okay. We're stressed beyond belief, so we're excreting magnesium. It's actually the first mineral that gets excreted when we're stressed. If we drink a lot of caffeinated beverages, we also, excrete magnesium in the urine. So get your magnesium intake up first, but then also move. Make sure that you're not sitting for longer than an hour at a time. If you are, these hip flexors start becoming tighter. They start becoming hypertonic or tight. So we got to stretch. We got to move. We got to drink lots of water, right? These are all basic things, right? We need to be sleeping correctly too. And everyone says sleep is so important, but we also need quality sleep. So, even if you have 1 or 2 drinks of alcohol a night, you're still messing with REM sleep.
Yeah.
If you have an excessive amount of caffeine, some people are faster metabolizers than others. That actually can, affect deep sleep as well. So many different lifestyle things always contribute to this. We always hear this all the time, but we always try to stress why these matter, why the quality of sleep matters, why the blood sugar control matters. Also eating low glycemic index foods, so we don't have this huge, blood sugar upswing, downswing throughout the day. But also, just getting 10,000 steps a day or trying to get that every single day with exercise. Pretty basic though, right?
Sure.
You got to do it.
But we forget to do that. I mean,
know.
Right? That's the problem. So you're talking about magnesium-rich foods, low glycemic index foods, movement, right? Movement after every half an hour, 45 minutes, so that you're moving, getting enough proper sleep. I mean, these are just the simple steps that all of us can start taking, right?
Yes. Yeah, but how do we implement that? Because it's so complicated. So you got to work with somebody usually. Because if we all did this, we wouldn't have chronic pain. It's under 17 million Americans that we do today, right? So we got to work with qualified practitioners to help us on this journey, for sure.
Well, thank you so much, for being with us. Any last comments that you'd like to add today?
No, thank you so much for having me. If anyone wants to follow what we do, you can find us at Fredrickson Health Solutions on Instagram, or my Instagram is Dr. Robert Fredrickson. But again, thank you so much for having me today.
Absolutely. Thank you so much. And for everyone else, just understand what we're doing, what we are saying, on following these simple steps on your daily life to help you alleviate some of the chronic pain or inflammation that you might have in your body. That's the message today. With that, thank you so much and have a great day, everybody.